in 8 couples in the U.S. face infertility problems, meaning it is difficult for them to have babies. That's more than 7 million people, according to Resolve. It is a national organization that tracks these numbers, and it's doing a lot this week to make people aware with National Infertility Awareness Week. Dr. Mylene Yao is a fertility expert here to talk about the National Infertility Week. It starts this Sunday, and there are a lot of questions to cover, so we're going to try to get to as much as we can. But first of all, for somebody who hasn't been through it, and that's 7 million people, so a lot have, what is infertility? What causes it?
That's right. So you have infertility when you've tried to conceive for 12 months and are not pregnant. So a lot of people can be going through that. But the good thing is about 85% of couples do conceive within 12 months. And there are many causes to infertility. For example, if there's any hormonal disruption that can cause a woman to not ovulate an egg on a regular basis, and any kind of medical problems with your reproductive organs, such as your fallopian tubes, your uterus, such as uterine fibroids, can also cause infertility.
And IVF is the most common form for couples to turn to help. What is that?
Yeah, actually, so IVF stands for in vitro fertilization. It is the most effective treatment on a per cycle basis for many men and women who are going through infertility. And it's very important for them to know about this option and to know when to start thinking about it. Even though most of them may not need to have this treatment, it would be, too bad if they miss this opportunity to build their families this way.
So when should they start thinking about IVF?
Sure. So first of all, when you're trying to conceive, if you have risk factors or if you have questions or concern about fertility, you should go see a fertility expert. You shouldn't have to wait 12 months, even though that's the official definition. And of course, if you have tried for 12 months and haven't succeeded, or if you're 35 years or older and have tried for 6 months, then we really urge you to go see a fertility specialist.
Okay, now cost in IVF, you always hear that it is extremely expensive.
That's right.
How expensive is it? Because a lot of couples won't be able to afford it.
That's right. And it can really vary. It can cost between anywhere from $8,000 to $20,000, and it really depends on some of the specifics of what you need. So I would urge men and women who are going through this to talk to your fertility experts and find out. Or it may be cheaper than you thought. So don't be intimidated by what you hear. Go find out, and there are many financial options right now that can help out families.
Have we seen any changes with the new health care law as far as insurance coverage? Are more insurance companies now covering this, or will they be?
It is still very tough, and I think many people are still working on that, and of course Resolve is really advocating for patients to do that. What we're doing at Univfy is that we have developed some Ivf Prediction Tests that will help men and women figure out what are the chances of having a baby with IVF. And that's very important to know when you're making some tough decisions about options and cost. So you can go online to www.univfy.com and take a test. This is an online data test that you can use the personal health data to figure out what are your chances of having a baby with IVF.
Well, that's a lot of options out there for people, and we're going to make sure to post this interview on our website so that they can get all of that information again and go searching for answers as well. Doctor, we appreciate you being here today and sharing it with us.
Thank you, Marni.
National Fertility Awareness Week starts on Sunday and goes all through next week.
That's right. Thank you.
Good to see you. Matt, back to you.